Thank you, everyone, for joining our AJS STARS Roses and Thorns virtual seminar series. Um, we are hosting Dr. Colin Martin, who is the division chief of pediatric surgery at Washington University in St. Louis. He is a surgeon scientist, also running a research lab. And being pretty involved with translational research. He's a family man. He played basketball back in the day. You can talk more about that, Dr. Martin. A very, very intriguing man in all types of ways. He's been a tremendous mentor to me personally, but also just in general. I've heard other people talk about his mentorship. So he casts a big net with the people that he tries to make a positive impact on in academic surgery, trying to encourage the next trainees to continue on that path. So Dr. Martin is a great person. He's a good guy to know. Everyone speaks so highly of how just easy it is to chat with him and get to know him, and just how kind he is. And I think that's refreshing in surgery where there can be stereotypes. But Dr. Martin is very compassionate. And so, without further ado, Dr. Martin, I'll let you take it away and talk about the roses and thorns of your academic journey.
Mario, thanks a lot. It's an honor to be here. I know I see a few familiar faces and some familiar names, and I appreciate everyone calling on and chiming in for the session. I think what AJS and the group is doing is phenomenal. And I found that when I have these sessions, certainly reflecting on my journey is beneficial, but I also find it refreshing for me personally, selfishly, to sort of think about the journey and also the questions that I'm sure we'll have a chance to discuss often allow me to think about different perspectives. And so for that, I'm already thankful and grateful for the next hour we're going to spend together. So I think maybe I'll just kind of give you my long spiel about who I am and what I do. Um, every interview that I've been on, and including the interviews to land at WashU in St. Louis, the first question they ask you is, tell me a little bit about yourself and why are you applying for this job? And so you have in the interview, you have 2 or 3 minutes to answer that question. Maybe I'll give you the 10 or 15-minute answer this time. And I think a little bit about my background, just kind of inform individuals about, who I am, the values that I have. And as I go through that journey, I'll talk about some of the roses and some of the thorns, that I've had to navigate. So I am one of two siblings. I have an older brother who's 2 years older than me. I was born in Wilmington, Delaware, a few years ago. And my dad was a chemical engineer, and he immigrated from the Caribbean to go to college. And he majored in mathematics and chemistry. So, a really smart guy. He tells me that when he finished college, um, because of his wanting to work to sponsor his younger brothers to come to college, he took the MCAT. He told me he got a good score, but decided not to go to medical school in order to work to sponsor his brothers. And so I feel like, my journey as a doctor, and in many ways, I'm fulfilling some of the dreams that he had to defer. Um, he and my mother were married, had my brother and I. And, as a child, I was a typical child. I had, believe it or not, those of you who know me, I'm a pretty calm person. But as a child, I was told that I was high energy, a little active. I talked a lot, um, pushed boundaries, things like that. So it's interesting that I think I've mellowed a bit. But as a child, I was a rule follower, and I worked hard. Hard work for me came in the way of sports and academics. And so for academics, I think I'm a pretty intelligent person, but along the way, SAT, ACT, MCAT, USMLE steps, I'm an above average test taker. So I'm never the 99th percentile. I'm a little bit above average. That's kind of where I land. In order to be above average, I had to really work hard for those grades. Like I finished college with a 3.4 GPA, and to get that, I had to work hard. In sports, I worked hard at basketball is what I played in high school and college, and um, just put the work in. And I found that, preparation and putting the work in allowed me to do a lot of things in sports. And so I played basketball at a school called Carson Newman University. It's in Knoxville, Tennessee. It's a small liberal arts college. And I learned a lot there. The student body was about 2,000, predominantly white institution, and there were very few Black students there. Most of them were athletes, great education, and I learned a lot. One thing I learned is that I think when you show up in situations, the people who are, sorry, my dogs are barking. The people who are really successful are the individuals that can be authentic to who they are, no matter who they're talking to. So what I mean by that is being on a college campus of 2,000 people with maybe 150 Black students, being able to be comfortable talking to someone who's Black, white, gay, straight, Muslim, Jewish, and really having an authentic exchange. It's easy to surround yourself with mentors and friends that are just like you, right? So Lamario, if your circle were all MD, PhD students who are doing cardiac surgery, or Mallory, if all your friends were residents going into pediatric surgery, you can imagine that there are going to be some blind spots that you're going to miss, that you're going to have. And so being at a school like that, it was like my training ground to be confident and proud of who I am, but at the same time, be able to find meaningful exchanges with people who are different from me. And I think that served me well, going forward. So played basketball for 4 years, small school. I was pretty good. I averaged about 10 points a game, 10 rebounds a game. It's kind of a scrappy player. Did the dirty work. And when I finished college, I'm 6'6". So of those who I haven't met, I know of you guys know Aaron and Wendy and Mario and Mallory. You know how tall I am. So I'm a big guy. I was pretty athletic. And so I had some opportunities to try out for overseas professional teams, but I always knew I wanted to be a doctor. And so I was able to get admitted to Wayne State University in Detroit for medical school. And I chose Detroit because during undergrad, I was born in Delaware, moved around a lot, but my family landed in Detroit. My dad's job took him there. And so being close to home was great. Um, my first year of medical school, my mother died from metastatic cancer. And so she was 54. And so being a brand new, I guess, medical student, you're sort of pushed into this role of having to navigate both something that's incredibly emotional and something that is medical, And so I'm trying to like look at x-rays if I know what I'm looking at, and then navigate the emotions that comes with losing someone who's close to you. And it was a time that I was glad I was home and close to people. And I think that dealing with that, seeing doctors up front navigate some of those things sort of further solidified why I wanted to be a surgeon. And at the time, I was interested in surgical oncology. So Wayne State was a great place for me to be. Busy patient, busy hospital. The medical students did a lot. I felt like I came out of there very well trained. I had I had a medical student that was 1 year ahead of me who did a away rotation at the University of Cincinnati, and he was someone who I really respected. And he said, "I love Cincinnati." I ended up matching there, so Cincinnati was on my radar. So I interviewed a lot of places, for residency and ranked Cincinnati #1. Ended up going there, and it was the best decision I could have made. Um, Immediately, the things that really allowed me to, I think, survive and excel through residency were the connections. And so I would say the roses in residency were the relationships that I built both with my peers, um, the relationships I built with the house staff, um, not the house staff, but the housekeeping staff at the hospital. The first house that I got invited to as a resident there was a Jamaican housekeeper who said, "Hey, are you guys free this weekend? I'm having a party at my house." And I was like, "Okay." And so I went to his house, and he had Jamaican music, some drinks, some food, and it was great. And so the roses for me were those connections that I was able to build in residency. Um, Residency was at times incredibly perfect, great, at times incredibly hard. The highs in residency were doing research and getting the awards. The highs were being recognized by your peers. I was our administrative chief resident during residency. The highs are the roses. Um, the roses were having attendings let you start a case or finish a case without them having the trust. The thorns in residency were at times it was isolating. At times, not having the networks and the connections that that could have been expanded more. That was hard at times. Some of the thorns were as you mature as a resident, as an intern, second year, for the most part, you're sort of being told what to do, and you have a really short leash. As a senior level resident, that leash is longer, and some of those patient complications that happen, you live them, you feel them, and so presenting at M&M as a fourth and fifth year resident, cases that either I was directly involved in or that were on my service, could be challenging at times. One of the biggest highs, sort of biggest accomplishments in residency is that I met my wife after my intern year. So we were married I met her after fourth year medical school. We were married after my intern year, and we subsequently had 4 kids, and we'll celebrate 20 years of marriage this summer. My oldest son is 17, and that's sort of been the biggest accomplishment, the thing I'm most proud of to date. Um, so Cincinnati for residency. I went and wanted to do surgical oncology, rotated on the pediatric surgery service, and I just immediately loved it. I loved the kids. I loved the attendings. It was a competitive, pediatric surgery is competitive. And so that was like intriguing. Like, why is it so competitive? That was intriguing. Um, and I immediately pivoted from surg onc to peds. And so I did 2 years of pediatric surgery research. I was able to match at Vanderbilt for my fellowship. My wife was from Nashville, and so I knew that, and we had young kids at the time. I knew that being close to home would be great. So we were really fortunate to rank Vanderbilt 1 and match there. And 2 years of just, you'll see, Mallory, it's like 2 years of intense training. The same highs and the same lows are that exist there, but you're doing something that you really love. And I was fortunate. When I was at Vanderbilt, I was asked a question that I answered honestly for the first time. The question was, what do you want to do with your life? And when I was asked that question, when I was in high school, when I was undergrad, the answer was always a little bit nuanced because I was trying to answer to make myself look good or be competitive or say the right things. For example, I went into the lab when I was a resident to be competitive for pediatric surgery, or I did a summer internship when I was an undergrad to be competitive for medical school. And so I did all these things in a very intentional, transactional manner. At the time, it didn't seem so. Yeah, I was sort of listening to the advice of my mentors, but when I look back at it, I did it to sort of get to the next level, which we all do. But for the first time, when I was sort of starting my last year of fellowship, my division chief said, "Well, what do you want to do? You're going to do private practice? You're going to do basic science?" And the it wasn't like an immediate like I'm doing X, Y, or Z. It's really introspective. I looked at where I wanted to be in life. I looked at where my family was, where we wanted to be. Um, and so the answer for me was I wanted to be an academic pediatric surgeon that does basic science. The reason, when I'm 100% honest, is that I think that platform will give me, that path will give me the biggest platform to mentor, to support, to be a gatekeeper at times, to advance the field and to advance science. Not saying that if I was in private practice group or if I was not a basic scientist, I couldn't do those things. But from my perspective and my reference, that was going to give me an opportunity. And so I interviewed a lot of places coming out of fellowship, and few places could really support both me as a clinician, where I wanted to be paid as if I was a busy clinician. I had young kids, but I also wanted to have time to develop a research program. And so it came down to three places. UAB was one. And what drew me to UAB was really the trust. When you talk to someone, even if you talk for a short period of time, you can tell by their body language, their mannerisms, how they communicate. If they say, "I'll email you in a few days," and they email you in a few days, that's a data point to establish trust. If they say, um, "Do you have any dietary restrictions?" and you say, "Yeah, I'm vegan," and they take you to a steakhouse, that's like they're not paying attention, right? I'm not vegan, but just as an example. Um, so I had that trust from the division chief at UAB and the chair. Landed at UAB in 2012, brand new physician, and I just went to work. It was the perfect job for me because it was a busy place with great mentors. And so the mentorship that I had at UAB was phenomenal. I had people that could mentor me on how to take out a Wilms tumor, mentor me on how to take out an appendix, people who could mentor me on how to show up and be more prominent on the national scene. I had people that can mentor me how to balance my time as a father and a husband. And I seek that mentorship out. And those individuals are willing to give it. Mike Chen, my division chief, Herb Chen, first Kirby Bland, who was a previous department chair at UAB, and then now Herb Chen, your current chair at UAB and editor in chief of AJS, and then Dr. Vickers, our previous dean, and others. But those individuals in particular were so supportive. Um, Probably about 5 or 6 years in to being a physician, sort of at that time, I was just promoted to associate professor. And in my mind, I always knew I wanted to lead for the reasons I mentioned, but I wasn't really comfortable saying it. It just felt weird for me to say, I want to be a division chief or a chair or a dean or something like that. It didn't feel comfortable for me to say it. And if I was talking to peers or my wife, yeah, we could talk about it all day. But for to have that conversation with my boss or my chair, uncomfortable. But about 5 or 6 years in, Mike Chen, my division chief, he just presented the relationship was open, that, the conversation was, "Hey, do you want to be a division chief one day?" And I said, "Yeah." But I always said, "Yeah, I think so," sort of not stepping into my full confidence about it, but I would say, "Yeah, I think so." But as I thought about it, that question became yes, that answer became yes. And the steps to do it, were to further develop, to understand your blind spots, what kind of leader you're going to be, just getting experience and networking. I think that's like the big thing. Um, so, fast forward, um, about a year and a half ago, I realized that I wanted to continue to have impact. I wanted to grow And with that growth was going to require a change for leadership. And so the way I went about doing it, and some of you, I don't know where everyone is in their training, but the way I went about doing it is I was very transparent. So I said to, Mike and Herb, hey, I'm applying for these jobs. And so over the past year and a half, I applied for a few division chief jobs. Um, some I didn't advance in the search. Three, I was selected, three different division chief jobs, but the WashU job was special. Um, WashU was special because when I was at Cincinnati, the person who was very instrumental in me loving pediatric surgery was Brad Warner. And Lamario didn't tell you, but I hold the Brad and Barbara Warner Endowed Professor of Surgery. So Brad Warner is the last division chief at WashU, who I stepped into after he stepped down from the position. So I've known him since 2003 as an intern, and we had that relationship. So has always been on my radar. WashU is also a very busy place, very strong clinically, but also has an amazing research footprint. So the NIH funding for WashU for departments of surgery is number 2 in the country, and for medical school, all departments is also number 2. So it was an opportunity where there were incredibly bright people, good surgeons, um, an opportunity to lead and grow. And so in September of last year, I became division chief and professor of surgery at WashU. Um, since the last 7 months, there have been tons of roses, maybe rose bushes, and a few thorns as well. The roses. So the roses are stepping into a place and knowing that you have an opportunity to promote, to enhance, to make the work-life balance better for a lot of people, not just surgeons, but also staff, residents, fellows, custodians, other service lines, like as division chief and surgeon chief, interact with a lot of people. So that opportunity / responsibility to me is a rose. Another rose is really watching my family grow and thrive. So we have 4 kids, as I mentioned, 17, 15, 12, and 11. They were, when we moved to UAB, my oldest was 5, and I think we had 3.5 kids or 2.5 kids when we moved to UAB. So now we're 4, and watching them go through the process to grow, it's been a rose. Um, Being a gatekeeper, having a say on our rank list, having a say on who we hire is a rose. The thorns at WashU, I mentioned my family thriving. Also, moving my family was a thorn, so the things that I value most in life are, my family and spirituality are sort of high on my list. And being a surgeon and a leader are secondary to those things. So watching my kids ask questions like, now, why are we leaving UAB? Don't we make enough money? Or why do we move to St. Louis? And being able to answer those questions really honestly so that a 17-year-old or 11-year-old could understand, that was tough. That was tough because it came down to I'm moving to WashU to advance my career, right? I'm now X, Y, and Z. But does it really make it better life for my 11-year-old? Like, is his soccer team going to be better? Is his school better? And those questions are hard to answer and reconcile. Um, Thorns, making tough personnel decisions, deciding who's the right fit for a group. That's been difficult. Um, Other thorns are work-life balance. Um, I'm at home right now, and I got home today about 6 o'clock. My daughter in Birmingham went to a school called Alabama School of Fine Arts, which is close downtown, close to UAB. And so she got out at 3:30 every day. And we lived out in the suburbs. And so probably 3 days a week, I was getting off from work around 3:30, picking her up and going home. And then if I had more responsibilities, I could get on them by Zoom. Here, I'm not able to leave work at 3:30. So I'm getting home on average, I would say about an hour later, 4:35, sometimes later with recruiting and dinners. And so that work-life balance, work-life integration, whatever you want to call it, I'm still trying to figure it out. Um, Other thorns, since I've been here in a leadership position, both, you know, challenging cases, complications that I may have, or complications that my partners have. And those are things that I think about a lot that weigh on me that before, if there was a complication that happened, um, if it was mine, it was mine. But if it wasn't mine, it was one of my partners. Now I feel like to an extent, it all represents me. And so just kind of getting that sort of balance, just kind of sorting it out. So um, I, I'm super happy to be here and talk to everyone. I feel like I've talked a lot. I could go on more, but maybe I'll just pause there and yield time back so we can get into a Q&A.
Thank you, Dr. Martin. That's great. I love it. Definitely learning things about you that I didn't know before, so that's always fun. Um, did anyone want to jump in with a question immediately? Um, if not, I was going to ask about kind of more of a question of I think where you were going. Is just what are the responsibilities of being a division chief? And then you mentioned like one of the thorns of um, being at WashU now is the work life, integration and getting home later and talking about like dinners for recruiting and then potentially other meetings. Has that changed because of your chief position now? Regarding like when you can get home, is it more administrative things, I guess, that you're juggling? So yeah, just if you could talk more about that leadership job itself, I think could be helpful for us to hear about.
Yeah. And I think they're all sort of intertwined in terms of the work-life balance and the duties of a division chief. I think in leadership, certainly my experience has been the leaders that have been most effective are the ones that have trust and have a strong relationship with the people they work with. Um, it takes time to develop those relationships. I think when you trust somebody, like my wife and I trust each other, so she could tell me something that I don't want to hear, but because I trust her, I'm going to listen. Or if, Lamar, if you and I trust each other, we could disagree on something. And if you feel strongly it should be blue and I think it should be green, and we're just going at it, because we trust each other, we can go at it, argue, and go back to a level of trust and a strong relationship because that trust is there. Trust develops over time, and there are certain events, certain meetings that it's important for the division chief, the surgeon chief to be there to represent our surgical footprint. That being said, I can't be everywhere all the time. And, what I've found is that I sort of like to make myself available um, for everyone, for meetings. And so if someone says, "Hey, can we meet?" I'm like, "Sure, let's meet tomorrow." If I say let's meet tomorrow, that means like tomorrow gets busy and it sort of clouds things. And so with my administrative assistant, we go over our calendar twice a week, and so that we have buckets and times to schedule things. And so what it forces me to do is it forces me to sort of think several months in advance about family vacations. For example, the school that my kids go to, they get Eid off They were off for Eid last week, and they get Yom Kippur off. So being able to look on the calendar like 3 months in advance, saying, okay, if this holiday falls on a Monday, it's a good opportunity for me to take this Monday off for a nice long weekend. Being able to like think that far ahead has benefited me so that things are kind of set. There's time for spontaneity and doing things, but thinking that far ahead has allowed me to sort of get more control of that work-life balance. But to answer your question specifically, there are more things where I need to be, where I need to sort of represent our division as we grow, and my vision is shared. It's a shared vision by our group. Then whether it's me or my partner, the message is going to be the same. But right now, some of the meetings are so important that I want to be sure that the message comes off the way I intend for it to be. Therefore, it's me sort of being the face and leading from the front. But as sort of things are more established, we'll delegate more and still kind of learning how to do those things. There's
You wanna?
a question in the chat. Should I answer that one?
Oh yeah, I didn't see that.
It's from Segun. Thanks, Segun. Um, Question is, can you talk more about running a research lab alongside your clinical and administrative duties at different phases of your career, from starting right out of fellowship through until now as division chief? Thanks for that question. So I did 2 years of basic science research when I was a resident. And then the way general surgery works, as you guys know, is that after your research, you come back and finish 2 or 3 clinical years, and then you do a fellowship. So I was out of the lab for 4 to 5 years. And so when I started at UAB, I was, I had some ideas, I had interest, I had resources. One resource was time, the other resource was money in a startup package. So I had resources, ideas, but in terms of how to really execute that, I wasn't like some where you could just give me some money and put me in a closet and I could generate papers and grants on my own. So I interviewed research mentors, and I joined a lab of a research mentor that was a MD PhD pathologist who studied gut physiology. So I started in her lab. We had some early papers, had some success. Um, the mentorship expanded a little bit, but I felt like what I was doing I was doing work that was prescribed by my mentor, which is fine sometimes, but we were doing one experiment and I said, these are the experiments I'm planning to do. And my mentor said, oh, those are great. Happy for you to do them, but we can't publish them until this paper is published because the authors might ask for the reviewers might ask for those experiments. And then we want to use those for additional experiments. And I said, there's no way I can sort of solidify myself, in that framework. So I didn't talk much yet about my work as vice chair for diversity, equity, inclusion at UAB, but I'm passionate for underserved, marginalized populations. Often in medicine, it's underrepresented in medicine, but it can also mean women. It can mean LGBTQ plus. It can mean anything. But I feel like, in order to best serve our patient population, we have to have all those voices at the table. So DEI is always a passion of mine. Um, Necrotizing enterocolitis is a disease that affects premature babies. And as you can imagine, mothers who are from disadvantaged backgrounds, who are young, under-resourced, they're more likely to have adverse birth outcomes, more likely to have babies who are premature, more likely to have babies who have necrotizing enterocolitis. So we thought that, I wonder, could it be the maternal environment that sort of predisposes babies to necrotizing enterocolitis? And so the concept of psychological stress during pregnancy and gut development was a pretty novel idea. And so about 6 years ago, we kind of shifted the focus onto that, exactly where I was ultra passionate about, underserved environments, ultra passionate about necrotizing enterocolitis, and we're able to sort of develop those things. Like just having a passion is not enough. You have to have papers, you have to have money, you have to have grants. And so as I've gotten busier clinically and administratively, um, there's definitely a need for people to help execute the work. And so I was very fortunate to be able to take two people with me from UAB to WashU, a postdoc and a PhD. And I meet with them twice a week. Um, so we have twice a week lab meetings. In those lab meetings, we're talking about upcoming papers, grants that we're working on. Um, but it's up to me to sort of set the tone, maintain the pace, the energy. We have two residents joining our lab this July, which I'm excited about. So to answer your question, Sagoon, it's been tough. The metric at WashU and it was at UAB for someone who's doing research, it has to be funded. And so we've had R21 NIH funding, and now we're submitting additional grants. And so there's pressure, but I feel excited about it, that the work that we're doing is going to be impactful. I see Isaiah's question, and Lamar, I'll try to answer shorter answers so we can get to more questions. Um, Isaiah says earlier you said that you are high energy and a talkative person. You also mentioned that a thorn in residency is isolation and can be lonely. What advice do you have for extroverts when pushing past low points in high stress environments? That's a great question, Isaiah. I think I know for me, if you had to pick introvert, extrovert, I'm more on the introverted side. I'm sort of right in the middle. I enjoy talking to people, but I also enjoy my time to recharge. Um, Residency can be isolating, so I think you have to really, residency, medical school, fellowship, you have to really have a tribe, a community of people around you. And those people may not be in your residency. You have to have at least three people that you could call day or night. Three, because if the first two people don't pick up, you got to have someone to talk to. You got to have at least someone that you can call day or night and talk to them about any topic, about anything. And might just be someone who's going to listen, someone who can give you advice, someone who could talk you through things. And so for me, I have those people. Like there's one person um, that our text code is, hey, let's get a cup of coffee. And that means I got to talk. So I'll call him and we'll just talk, and he'll listen, or he'll call me and I'll talk and he'll listen. Gotta have those people. How do you find those people? I think you find those people by being it for other people, right? So if someone reaches out to you, be available, be vulnerable, like if someone tells you what they're going through and you've gone through the same thing, whether it's a health issue, whether it's a complication, whether it's a relationship issue, whether it's whatever, like I think having those experiences yourself, maybe you've gone through it, but to really share that experience with someone else, it's helpful. And so be vulnerable, be there for people, and develop that tribe where you have people you can count on in those situations. But if their tribe is sort of in a different country or a different state, then it can be really physically isolating in residency. And so really look for commonalities you have with people, whether you can get together on hunting, or you have a love for wine, or you have a love for sports. Just find those individuals and just connect with them, and don't make it a transactional connection. Like you don't want to connect with, like Lamario, say like you and I both love Lakers basketball, right? Like you don't want to talk Lakers basketball with me just so you can show me that you're, a Lakers basketball fan, so that I can think more highly of you, so that I can sponsor you more, right? Don't make it transactional, make it organic, make it know that some of these relationships that you try to form, they may never help you in a transactional way, or they may help somebody else. And so just kind of approach it that way. Anna asked me, thank you for your talk. As a leader, can you talk about your experiences balancing very different personalities, especially us surgeons? Um, that's a great question. And I certainly don't have it figured out. Um, I certainly am learning. I think personalities and surgeons sort of contribute to a culture. And I think as a leader, the culture is reflective of who you are. Like if the culture doesn't reflect who you are, either you promote a bad culture or you're not an effective leader. And I think I heard a definition from Wayne Frederick, who used to be the president of Howard University, who's a surgical oncologist. And I heard him talk at a meeting recently, and he said culture is defined as the behaviors that we tolerate and celebrate, right? So culture is the behaviors that we allow to happen, simply. So as a leader, if I know people are inappropriate with our learners, if they cross sort of personal space barriers, if I know our leaders will yell and scream at the scrub techs, but they're so nice to their colleagues, if as a leader I know those things, then and I do nothing about it, that means I'm contributing to the culture. So how do you balance those personalities? It can be really hard. It can be really hard, particularly if someone who detracts from the culture happens to be a talented surgeon or happens to be, a talented researcher. Really hard. I think it comes down to what you really care about and what your values are and what you're willing to risk. And so for me, those strong personalities, I always give people the benefit of the doubt when I start off. Like if something happens, I want to hear their side of the story. I want to understand what's going on with them. And if I know them, we have a relationship, they may be willing to share, gosh, I lost my cool. I was up for the past 2 nights at home because I'm having some issues in my house, right? I understand those things. At the same time, it's very important that those behaviors that happen, that the people who are involved with on the other side, they kind of know what happened and what the follow-up is. So I'm still learning that, the things that there are things that I know that will absolutely not tolerate no matter who does it. And there are things that are more nuanced. And so I think as you have relationship and trust with people, then you can sort of navigate those very difficult things. Um, should I keep reading the questions, Lamar, or you want to?
No, yeah, go ahead. Yeah.
Okay. All right. This is from Serena. The font's a little smaller, so my 40-something-year-old eyes are let's see. My question is about your earlier reference of feeling like some steps along your journey were transactional or just to get to the next step. What advice would you give to early residents so checking those necessary check boxes don't feel so transactional? And thanks. It's a great question, Serena. So I think the advice is following the advice of mentors, and having a mentoring team around you. And so some of the things that I did in residency, I did because my mentors told me to do it. And there's people that I trusted. And it comes off perhaps transactional if you're doing something just to check a box. But every time you do something, whatever, no matter what the task is, you are learning something from it. You're representing yourself. You're representing your brand. In my case, I'm representing a division in an organization. Same for you guys. And so every time you're sort of checking a box, you're also representing yourself. So if in order, not if, but in order to match into something like surgical oncology or to get into uh, 4-3 cardiac program, Lamario, you gotta do some stuff, right? You gotta um, have some research, have some networks, have some national presentations and publications those are boxes that you're checking. But if someone says, yeah, in order to match into ped surgery, you have to present at the AAP and you submit an abstract to the AAP that's not well formatted, not well formatted, it gets on for a poster, but the people who read it, they're looking at the grammatical errors and the setup. You've checked that box, but you really hurt yourself. So I would say it seems transactional because you're giving and you're getting, and it is, but at the same time, you're learning and you're representing yourself, and you're growing. So I kind of see it that way. All right. So keep going, Mario. Okay. This is from
Yes.
this is from Tolu. Um, Thank you for taking the time to talk to us today. I had two questions. The first question is, what are some of the thorns you face while navigating a career in pediatric surgery as a Black man? And what does the future of pediatric surgery look like for people of underrepresented populations? And secondarily, as a medical student in a medically underserved area with no ped surgeons, what is your advice for students interested in pursuing a career in ped surgery? Great question. Um, Thanks, Tolu. So um, being Black in pediatric surgery has been really interesting. And maybe it's just all surgery, but there are a few people, and it's probably these individuals in all specialties of surgery and medicine, but there are a few people in pediatric surgery that accomplished a lot, and they happen to be Black. Um, Henry Ford, who is the dean at the University of Miami, and Ed Barksdale, who is Surgeon Chief, just left Ohio, is now in Chicago. These individuals, when I was coming out, um, sort of residency and fellowship, they were mid-career surgeons, but they checked all the traditional boxes that any academic leader would have checked. NIH funded. They had leadership in national societies. Um, as I've gotten to know them, they are exemplary husbands and fathers. Um, they've done all these things. So having like someone who looks like me to have done it is was incredibly helpful. Um, being sort of, being, Black in pediatric surgery or Black in surgery, there are certain things that you're going to encounter and see and that you have no control over. I walked into a room at UAB and I was seeing one of my partner's patients, and he wasn't expecting it to be me. My partner was white, was expecting it to be me, and I could see immediately from his body language and how he crossed his hands, he was not happy with who I was. And those situations to me, like, doesn't bother me. I'm not going to change your upbringing. I can't change how I look. What bothers me, or what bothers me, is when there are opportunities, or I see opportunities that not everyone has access to because they don't have the network to know those opportunities exist. It's not just being Black, it's just sort of sometimes some trainees don't have those opportunities, but there could be white trainees that still don't have those opportunities. That bothers me, where there's sort of uh, hidden agenda, hidden curriculum that people just don't know in order to succeed. Um, so having mentors, having people who could understand what it means to be Black, or people who weren't Black who still are, understand that the path is slightly different. Like the way, when George Floyd was murdered, it coming to work was a different experience for me versus someone who's not Black. Having sympathy towards that, understanding that whether you're Black, white, that's hugely impactful for me. Um, your question, Tolu, about what advice. So pediatric surgery is largely based on your mentors and who you know. And if you're at a place where there are not a lot of pediatric surgeons, I think you have to connect with people outside of your institution. Have people give you warm introductions. What a warm introduction is that Tolu, if you want to meet someone at WashU, you say, "Hey, Dr. Martin, connect me with Dr. Chapman here at WashU." So I'd email Dr. Chapman, who I know, CC you on the email. It's a warm introduction. So Dr. Chapman has a frame of reference about who you are and that you and I have a relationship. You got to have those warm introductions with people and cultivate those relationships long distance. How do you do that? You set an alarm on your clock, on your phone every 2 months. Think of something that you've done to update them on what you're doing. Hey, just want to let you know I appreciate our interaction. I was fortunate to get a talk on at the AAP. Um, hey, 2 months later, hey, I'm solidifying my rank list for literally your approval on it, or your advice on it. Connect with those individuals, and over time, although you're not at the institution, there will be a body of work and data points for those individuals to advocate for you and promote you.
Thank you, Dr. Martin, for going through all those questions. Does anyone else have any questions they want to ask?
Tolu, do you have my email address? I'll put it in the chat. How about that?
Hi, Dr. Martin. My name is Charna Kennard. I'm one of the co-chairs for the AJS STARS programming committee. Very sorry for my tardiness. I'm an intern and I just got off. But my question for you is, how did you decide on not only being an academic surgeon, but going a leadership route as well?
Thanks for your question, and thanks for your service to this organization and what you guys are building. Yeah, academic surgery means a lot of different things. You can be an academic surgeon and work at a place like UAB or WashU or any place and not publish any papers, but you fulfill a mission of clinical service to your patient population. You can also be at a place and publish a lot, have impact nationally, but you're not at a traditional academic place. So for me, I wanted to have the best of both worlds in a sense where I wanted to be around people who were engaged in research, around people who were engaged with learners and trainees and at the national scene. But I also wanted to be able to have impact on the environment, the culture, and have a platform to really grow and change our field. And so I think sometimes you can do those things without the leadership title, and you can have great influence without the title. But I think you go further if you have the title with great influence, the title with great impact. And so I wanted to have those opportunities to shape the local environment and have impact. And so having that leadership position allowed me to do that.
Thank you so much.
You're welcome.
Anyone else want to ask a final question, perhaps?
I have a bit of a spicy one. Just given legislation on DEI, I know Alabama's just passed our own kind of problematic law. I don't know if Missouri has, but just kind of curious, as previous vice chair of DEI, kind of what your thoughts are on how higher ed educations, like institutions in general and residency and fellowship programs, can continue to improve diversity despite those legislative hurdles.
Yeah. Yeah, I think improving diversity is what it gets down to. And what does that really mean? I think it means that no matter who walks into your organization, whether it's a patient or a trainee faculty, no matter what their background is, their preference, their religion, that they not only feel comfortable, they can thrive and be seen. Um, and you don't always need a title to do that. What you need, or a vice chair to do that, or to call it that, what you need, it's simple. You need the person at the top to care. Simple, right? If the person at the top doesn't care, it's not going to happen. It's not going to have legs. It's not going to have impact. And so what does caring mean? Caring means that on all the things that the chairs and the deans and the division chiefs have to think about, thinking about equity, inclusion, and diversity is a natural thing. It's not a thing because it's popular. It's not a thing because our sister organizations are doing it. It's a natural thing because it's how they're wired. And people can feel that. Like if you talk to someone, if you happen to be from a marginalized group for whatever reason, or minoritized group, and you're talking to someone and they are giving you eye contact, they're engaged, they're really interested in your culture, they ask you questions. What does that feel like? You can tell if someone's being performative, if they really care. So when the leadership cares, it's going to trickle down. People who don't care, they're going to say things like, yeah, he's good. He's a good leader, but we just didn't see eye to eye. But people who really care, who buy into that culture, they're going to stay and perpetuate that culture. So it's a challenging time. We have election year coming up. Who knows what's going to happen? Whatever the result of the presidential election, it's going to be polarizing. It's not going to be a landslide victory. Half the country is going to be happy. Half the country is not going to be happy. And what happens is those things that are sort of at the margin, they become, really pointed discussions. And so I don't know that you need legislation to say it's okay to do something or not okay to do something. And I think if you care about it, you're just going to do it. That's my take on it.
That's an awesome answer. I love that. I've loved all of your answers. Definitely want to show appreciation for you taking your time to be vulnerable with us and share your wisdom and your journey. I've learned a lot. And yeah, it's always cool to hear from someone that's like in the position that you want to be, and how you've gotten there, and like, what you hope to do moving forward. I think it's a very exciting time for you being a new division chief. So I'm excited to see how things go there. So definitely want to appreciate you taking the time. Appreciate everyone for showing up and asking really good questions. And getting this valuable information from Dr. Martin. So thank you all to everyone.